The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Welcome to the Everyday Therapy Podcast. I'm Julian Schroeder.
And I'm Jacy Rader. And that's Whitney Bunch up in the corner. She's muted for some reason. Hello.
Does she have a voice? We don't know.
I do. Okay. Calling in on Skype, so
yes.
A little different.
Yes. And we are all therapists and yoga teachers at White Rock Counseling here in Dallas and San Antonio. And we're excited that you're tuning in so that you can hear inspiration, tips, and stories for your everyday therapy life.
Yes. And we are not newly anymore. We are on iTunes. So please help us out, rate, review us, subscribe, give us some feedback, and tell us what you want to hear, what you like, what you don't like, all that good stuff.
Yes, so, we would love you for that.
Yes, forever. Please.
Forever and ever.
Do it now. But today we are talking about anxiety, and it's just us today. So it's kind of fun and different.
Yeah, and I am going to put Jacy in the expert role.
Ooh.
What? We're switching roles
No pressure.
Here. Yeah. No, but Jacy, I mean, you do, and we all work with anxiety. Like, Whitney, you and I work with anxiety that manifests in a different way a lot of the time, right?
Right.
But Jacy has really honed in on all aspects of anxiety, and we're excited to get into that.
For sure. Yeah, and I think the reason that I came into the counseling field was because I experienced anxiety and had struggled with it for so long. So I not only, as most people do have experience with anxiety, but really struggled with it as well. So I'm excited to talk about this today.
Yes. Yeah, no, and I thank you for, I think for a lot of therapists, in some ways, we find our specialty based on some sort of like personal experience. Like there's a level of understanding and empathy.
Yes. Yeah, and just getting it on a very deep level.
Yeah.
Of like what is actually going on.
Yeah. So when a therapist says, I understand.
They really do.
Yes.
Yeah.
Yeah.
Yes. I mean, it's what makes the work valuable to us.
For sure. Yeah. And meaningful.
Yeah. And of course we keep ourselves in check, so we're not identifying too much with somebody, right?
Oh yeah. Definitely.
But it is helpful. So with that, Jacy, how would you define anxiety?
Yeah, that's a good question. So there's definitely a difference between stress
Okay, thanks for saying that, because
anxiety.
That's an interchangeable terms, right?
Yeah. I think that like in our culture we say like, oh, I'm feeling so anxious today, or we kind of use that interchangeably. So I think there's definitely a difference between like diagnosable anxiety and kind of situational, like stressful anxiety. So, and the way that I differentiate stress and anxiety, like stress is more like nervousness, and anxiety is more helplessness. Like stress is nervous, like frustration, and anxiety is like feeling super helpless, and out of control and overwhelmed.
If I can jump in, I think one way I like to think about it is stress, like you said, nervousness, meaning, okay, there's a lot that I have to do. And that helplessness, like you said, it translates into like this belief I can't handle.
Yes. Yeah. And I think with stress, like you can normally identify like, oh, okay, work is really bothering me. With anxiety, it's often like there might not be something that you can identify is the problem, but there's this general sense of feeling keyed up.
Yeah, I really like the helplessness. It's like impending doom. Sometimes you can't even pinpoint what it's about.
Yes.
Yeah, the tendency to just like assume that everything's going to go wrong.
Yeah.
Yeah, there's some good memes on that.
And I think that anxiety can be triggered by stress. Like there can be a stressful situation, and then if the stress isn't taken care of and managed, then it can turn into anxiety. So, and maybe we can talk about symptoms of anxiety, and we can all kind of share like what our personal symptoms are, or like what we see within clients as well. But one big one is just like kind of physical restlessness, mental restlessness.
Tension.
Yes, muscle
Like
tension.
muscle tension.
You can feel it in your body. Like for me, it's my shoulders and my ears.
Your ears?
Yes, just like
Yeah.
Oh, shoulders in your ears. Okay.
Yeah.
Because like your ears are tense.
Ears.
That's new.
Oh
That
my
is
gosh.
special, Jacy.
Yeah.
It could be like upset stomach. Like IBS is kind of correlated with like stress, anxiety.
Yes. Irritability, like just being moody and like kind of brooding or flying off the hinge, something that you may not normally bother you.
Yeah. Low concentration, irrational fears.
Yeah. Difficulty sleeping.
Yeah.
I also think about stress sometimes, like we've talked about, I think on here, like the bell curve of stress.
Yes.
Like stress isn't even always bad. Like stress can be helpful. It can help. It's like us revving ourselves up to perform or take care of something, like we're getting ready. And, you know, a certain amount of stress keeps us on time, and it keeps us paying the bills and not being late to everything.
It's helpful.
But then there's, oh, go ahead.
It's helpful.
Yeah. So stress can be like our friend and like keeping us doing what we need to do. But then there's like the over bell, like when you've gone over the bell curve and there's stress that cannot be utilized, it's excessive, that kind of starts bleeding into like anxiety.
Yeah, it's unproductive.
Sure. Yeah, I think that positive stress, I think the technical term is eustress.
Eustress? I haven't heard that before.
Yeah.
Yeah.
EUSTRESS.
Oh, yes. Yeah.
Yeah. So like, yeah, like you're saying, what's the function? It does provide some motivation. So anxiety can be helpful, right? And I think, Whitney, you wanted to touch on like the historical and biological reasonings of like how anxiety has been helpful in some ways.
Yeah, well, when you include like, and I think Jason's going to go into this, like the nervous system, like anxiety is kind of lives in the nervous system. So in some ways, like we developed that to like help seek out threats. It's the reason we can like slam on the brakes if someone stops in front of us. Like it has a purpose in our bodies and in our brains. It just gets to where we start like scanning for threats all the time, and then we can have like cognitions develop that are, I'm bad, everything's going wrong, people hate me, when really like that's not really helpful. Slamming on the brakes is helpful, but those things, those cognitions that can get tied to it of like the negative psychology theory, not so helpful.
Yeah. It's super primal, like scanning our surroundings like unconsciously for things that can harm us. And so like being on the lookout for those things. But like you said, whenever it goes like over that limit to where it's a constant and like hindering your functioning in some area or another.
So I don't know. I guess I think in the context of relationships, because maybe it's I have attachment-based anxiety.
Yes. Oh, for sure. I think
so
I can relate.
You
Julian.
can. Thank you. Thank you. That makes me feel better.
Like a smidge bit of relationship anxiety.
Yeah, relationship anxiety. So an example of that might be like it would be normal to question with getting to know someone like, okay, do they like me? Are they going to stick around? And when
Are they going to hurt me?
They hurt me, right?
Yeah.
Okay. But if after deeming a significant period of time where they have been consistent and trustworthy, there is still that anxiety and that, oh, they're going to leave me, that would fall under kind of like that anxious.
Yeah, like unproductive anxiety. And something that I think that you can do something about, like have awareness of and change. For sure.
Yeah.
And I wanted to talk a little bit about some of the basic fears underlying anxiety. So, and there's like different anxiety disorders. Like we say it oftentimes like just generally like anxiety, but there is a general anxiety disorder. There's a panic disorder with panic attacks involved, a social phobia, which is hard to go out and mingle and like have conversations with people. Specific phobia, like maybe fear of vomiting or fear of eating. It can be super random spiders, typical phobia. PTSD, post-traumatic stress disorder, and OCD, obsessive compulsive disorder. So we'll mainly be talking about kind of that generalized anxiety today, I think.
Sure. Yeah. And knowing that all these disorders can affect up to, I think the recent stat is like 18% of the population. Yeah. So all the variations of anxiety, right?
Yeah.
So I don't know. I'm like trying to, in my own head here, like put a number on that. So it would be a little less than 2 out of 10 people.
Yeah.
That would struggle with some form of anxiety. And
that's in like 2017, right?
Yeah.
So like over somebody's lifetime, it's probably like more like everyone.
More like
yeah.
everything.
And then, I always am questioning, like, how is this information gathered, and is it based on self-report, and how true are people answering, right? Because we want to always portray ourselves like we have it together. So I don't know.
Yeah, who knows?
So I
if
think it
that's
could be
true.
more.
Definitely.
I don't know.
But some of those basic fears would be fear of losing control, fear of not being able to cope, a fear of failure, fear of rejection or abandonment, and fear of death and disease. So like those are the basic ones, and then there's other things like layered on top of that,
Sure.
right?
Where's the fear of public speaking?
Right? Fear of failure, fear of
Right.
rejection.
Yeah,
yeah.
Just like I feel like that should have its own separate category. But
Yes.
no, I tease.
Yeah, and same with the relationship
Yeah.
anxiety, right?
Oh gosh, yeah.
I love that list. I think that's so helpful to be able to, because anxiety can feel so like, I don't know what this is about. It's just like impending doom, to maybe look at that list and be like, what is maybe like the root cause underlying, which one of these fits for me.
Right. Which kind of leads to like, where the heck does this come from?
Yeah. So how is anxiety formed, and what are the factors that go into it? And it sounds like, and Jacy, you can attest to this with your clinical work, that there is an element of the nurturing, the parenting, the early life experiences that can contribute to those fears.
Oh, for sure. Yeah. Yeah. I think that it can be hereditary, kind of passed down, like kind of in our genes in a way.
Yeah. So that's the biological aspect.
The biological. And then, growing up with parents that are super cautious and kind of over controlling can kind
Helicoptering?
Yes, helicopter parent. Yes. I always love that image. It looks so funny in my mind. But that parent kind of puts those beliefs like on a child of like, I have to be overly cautious of, the world around me. And then I had some other stuff written down and I can't find it, type of the parenting stuff. So, let's see. Okay, here it is. If your parents are overly critical and set excessively high standards, which kind of reminds me of perfectionism, right? So it's kind of that own belief that like, I have to be perfect. Okay, well, we can't be perfect. So that is going to bring up some anxiety.
Sure. And, I would add to that, as well as being overtly critical, I think really looking at the subtle messages that are sent. Because I think I grew up in a very loving household, and at times I will admit there was these underlying messages that, things had to be perfect and okay, and it wasn't like overt criticism.
Yeah, for sure. Yeah, I think that, like we talked about last week, like parents are doing that the best that they can, and they've learned it somewhere, and it doesn't have to be a direct, like, abusive situation for it to be, like, hurtful or, like, hard to manage as an adult. Another one would be, parents suppressing your expression of your feelings and assertiveness. So not really learning how to express your feelings or learning to trust yourself, to stand up for yourself, but kind of always like looking externally for that.
And Jacy, from my experience, it seems like a lot of these parents, when, doing the best that they can, a lot of it comes from their own discomfort. Is that something that you see as well? Like, so in terms of like if children aren't allowed to express their feelings and be upset or angry and, they have to be the good child, it's because the parents just don't know how to deal with
Oh,
those
for
feelings.
sure.
Yeah.
Yeah. I would think so. Definitely.
Yeah.
Yeah, because we're teaching, our kids what we know, what we've learned. So that's why it's so cool to have these awarenesses as an adult and kind of have, like, make corrective experiences so that hopefully you can give your kids a space for that or other people a space to express their emotions and kind of be their own person.
It also reminds me of just like you can kind of be predispositioned to it. There's a story in one of the groups that I lead at work where like the sensitive child, where like like say for example, like a mother is very upset and she's crying, she's in the living room, and the non-sensitive child is like, "Mom, what's wrong?" And she's like, "Nothing, it's fine." And the non-sensitive child's like, "Oh, cool," and like goes back to playing. Whereas the sensitive child is like, "No, what is it? It must be me. She's not telling me. I did something wrong."
Yeah,
So it can just be like how you are interpreting things.
Yeah, and it goes back to like that genetic piece of like just like hair color, right? Like one kid might have brown hair and one kid might have blonde hair. Like one kid might get that like sensitive, anxious gene and the other one doesn't.
Yeah. Like natural temperament definitely plays in. Yeah.
For sure.
I mean, I so identify with that. Anyways, we don't have to make this episode about me, but
Well,
I identify that.
We can have our own therapy session, Julia. But yeah, so her, genetics, it being situated, and so I would say, like your predisposition to anxiety, that typically is more of the chronic anxiety that's like more long term, whereas like situational anxiety is more like short term and a little bit easier to manage. Yeah.
Yeah. So one could argue that everybody has experienced situational anxiety, whether or not they're predisposed or have.
I would
right?
think so, unless you are a robot or an alien.
Right. So let's think, I don't know, what are some common situations?
Oh my gosh, I have so many. Should we go down a list?
Yeah, name some off.
Okay. So I told Julian and Whitney I would tell them a story I've never told them. I don't think.
Story time.
Okay, so I was at a dinner one time and it was out with my friend Elizabeth, if you're listening. I was with her whole family. It was a special like birthday dinner. Really, really nice restaurant. And I was eating and I swallowed it was an almond and it got stuck in my throat and I knew that I was choking on this almond. But I could still talk and I didn't know at the time that if you talk, you're not choking. So that was a little embarrassing. But I was like holding my throat and I stood up and I was like, I'm choking! I'm choking! And I had a panic attack.
Yeah.
Like while that was happening, I had a panic attack. So heart racing, heart palpitations, sweating. And so from that point on, like eating for the next year, I would occasionally have panic attacks whenever I would eat. Because I just had that same sensation of swallowing. So I already had.
It sounds like you had it really deemed that as like a traumatic experience.
Yeah, for sure.
Like your brain interpreted that as like, oh no, I'm going to die.
Yes, yeah.
Right? And so then.
Really scary.
Yeah.
For sure. What are y'all's?
Yelling, I'm choking.
I'm choking!
I'm going to die.
I think I was like 22 at the time, so thankfully I know now. Doesn't mean I'm joking. I can talk.
Oh, I don't know. I can't think of a specific one off the top of my head, but I just think if anything catches me off guard or something like I'm not expecting it, that tendency to like catastrophize, like, oh no, this means that they're mad at me, or I did something bad, or I'm going to get fired, or, and sometimes that like runs in the background, you know, like sometimes it's not like in my.
Yeah. Yeah. And I think because we talk all the time, all of us. And so, Whitney, one of the ones that I think of for you too is like making decisions sometimes is anxiety provoking as well.
So going back to like Enneagram podcast, like being a 9, something that is hard, like any transition or anytime there's to make a change, make a decision, transition into something new can be like very anxiety provoking. Because it's kind of my brain likes to be like, there's no right decision. You're going to mess it up. You're going to make the wrong choice. Like that's just the automatic negative thought for me, is that like, no matter what the option is, I'll choose the wrong one.
Yeah. Yeah.
Which is kind of leads into that like perfectionism thing.
Sure.
Yeah.
Sure.
Yeah.
But I mean, I think you speak to a really human element of transition and change. We as humans prefer consistency, like predictability.
For sure.
And so I think for anybody who's listening, okay, if you are going through a change, whether it's going to college, changing jobs, you know, adding to your family, or your family, you know, because of a divorce, or whatever, that is really natural to have an anxiety response.
Definitely. Yeah. I even find whenever I travel, I like notice the subtleties of my body, because I've like really tuned into that even whenever I travel. So that's change, like out of my normal routine, normal day to day, out of my home, all of that. Like I notice myself getting more anxious, or even like you're saying, like a positive change.
Right. Yeah, because I'm like experiencing that right now for myself, and just making some transitions in the way that I'm focusing in on my work. And even though it's good stuff, I feel just like a little unsettled.
Yeah, ungrounded.
Yeah.
In that way. I think that's cool to point out, because like newlyweds, you know, like you would think that'd be a really happy time, but I hear that so more often than not, that it is like stressful and really scary. And to put that on somebody of like, oh, you're supposed to be happy and feeling calm and cool and collected, you know, like, no, that's not how it's supposed to be.
Yeah. And like pregnancy too.
Yes,
you know, I'm thinking of all my pregnant friends, Noelle, if you're listening, my good friend Becky.
For sure.
You know,
I think it's just like, no matter what, like change, positive or negative, it's just a little unsettling.
Yeah.
Change is uncomfortable, even if it's good.
Yeah. And to know that and not judge yourself for any sort of reaction, like I think is one way to cope with situational anxiety.
Yeah.
Oh yeah. Oh my gosh. Talking about anxiety, we can like really layer it on.
Yeah, like make it perpetuate it ultimately by your thoughts and shaming yourself and being critical of that. Like that is absolutely a way to make it worse.
Yeah.
The good old shame spiral.
Yeah. Good stuff.
Yeah. And speaking of anxiety, I'm getting a little anxious because I forgot what question I was supposed to ask next.
No. I think that maybe we could talk about like treatments for anxiety, just kind of more the empirical, like research treatments.
Yeah.
And whatnot. So some of the ones that like are effective and well researched would be relaxation training. So being able to train the nervous system how to calm down. And I love describing the nervous system because I just think that it's so important, and it's such like a physical, concrete aspect that just makes sense. But and we already talked about this, I think, on the yoga podcast. I'm going to talk about it again.
Sure. Yeah, because it's just that important.
Yeah. Every podcast. Okay, here's our nervous system talk. So we have our parasympathetic nervous system, that rest and digest, the sympathetic nervous system, which is that fight, flight, or freeze. And so one's not better than the other. We don't want to always be in the parasympathetic nervous system, that calm, cool place, because that would be depression, right? If we were always there.
Right.
And then we don't always want to be activated in that sympathetic nervous system, because that's when all those stress hormones go out. And there's a lot of illness and disease with stress. So being able to tap into both of those things. And with anxiety, we are typically in the sympathetic nervous system more often than not. So being able to turn on the parasympathetic nervous system by for so long they thought like, oh, we don't have control of the nervous system ultimately, like it's autonomic.
Just have to.
Yeah, just deal with it, basically. But now we know that the breath, like everything is involuntary, and the breath is involuntary, but we also have control over it. So the breath is the one easy way to get relaxed. There's so many other different ways as well. But yeah, tapping into the breath and really deepening the breath, because with anxiety, more often than not, you have short, shallow breaths, kind of in your chest. And I can see that with my clients that come in. And it's so interesting how difficult it is and weird. They say weird and abnormal whenever I teach them to breathe with their diaphragm, to kind of use that belly breath. It's so different whenever you've been doing it for so long.
Yeah. No, I know that when I went through my yoga teacher training, and Whitney, I don't know if you remember the weekend devoted to breathwork pranayama.
Yeah.
But it really highlighted, I was like, oh my gosh, I have not been breathing the right way the majority of my life. And I didn't know that.
Right.
Well, yeah, I think that was like one of my bigger takeaways from the yoga, which I probably said, but like knowing that there's like stress, tension, emotions, anxiety, like in your body. And so sitting down and like taking your shoulders out of your ears and breathing, like really has a, like, it's effective. It works.
Yeah. Well, and same with like muscle tension, right? Like just like you're saying, relaxing your shoulders down your back and relaxing your fist, and your arms and your legs. That there's what's called progressive muscle relaxation, walking through the muscles of the body and relaxing them. Because I feel like the body and the mind is like a school of fish. Whenever one turns, then the rest of the fish turns. So if the body, which you have maybe more control of sometimes than the mind, if you can relax that, then the mind will relax. Or if you can use your breath to relax the body, then the mind relaxes. Right. So it's really cool.
Yeah. And it seems like a big element, other than really looking to shift the nervous system and really being able to find that equilibrium, is also the fact that when you drop into your body, you get out of your head. And so these thoughts that you've attached to, there's some space in between.
For sure. Yeah, that's a good point. Yeah.
So a combination of both things.
Yeah. I think that there's so much to that, and you really have to try it to experience it to see, what you get from it. For sure. But other effective treatments, obviously therapy is a big one. So worry exposure. So being able to tolerate the discomfort. And Whitney, you said this earlier, it's not about getting rid of your anxiety.
Yeah. So some of the things that we like work with in acceptance and commitment therapy and DBT is more like getting space from things that are like dysregulating for you. So it wouldn't be the most effective goal to be like, I'm going to bring my anxiety down to 0, or I'm going to get rid of all my anxious negative thoughts. But to learn skills, because we just kind of have automatic negative thoughts, like they're little word machines. Our brains are going to like throw those things out. Like there's no stopping it, So learning skills like, okay, I'm having like this tidal wave of like automatic negative thoughts, and using like a skill like diffusion, which is to get some space from your thoughts. So you're trying to shift into the observer perspective of noticing your thoughts and feelings. So it's I'm not my thoughts and feelings. I have thoughts and feelings. I'm observing my thoughts and feelings from this observer perspective, where I can have some space and like see what's going on for me without being like extremely reactive or attached to it.
Yeah.
Could you break that down? Obviously, I know like ACT and the specific languaging of that, but do you have an example that you use with clients?
So this is more of like a meditation, but sitting down, closing your eyes, taking a few deep breaths, and trying to almost pay more attention to the thoughts in some ways, but to notice what thoughts are coming up and putting them, one of them is thoughts on a cloud. So you sit down and you're
cute.
like, I'm anxious. And you imagine that thought on a cloud and you watch it pass by in your mind's eye. So it's like you're watching yourself thinking, and then you think, I'm a bad person, and you watch that one float by, and you're just like watching the thoughts go by. So it's just a different way of like relating to your thoughts. I also think of it like I don't know if you're watching, you can see it, but sometimes we are fused with a thought. So maybe an anxious thought for you is like, I'm stupid. And anytime anything happens that triggers that feeling of like feeling embarrassed, or maybe you did something a little off, you just think I'm stupid. And if you're fused with the thought, it's like all over your face. I have my hand on my
close.
face.
Yeah, it's very close to you. You can't see anything else.
Yeah, you can't see around it. That's what you think. You've labeled yourself. So diffusion is kind of like I'm moving my hand away from my face. So
and I can see other things, but that thought's still there, but I can also see other things there.
Yeah. So imagine turning down the volume on those thoughts.
Yeah, when it gives you more clarity. So rather than just assuming, oh, I'm stupid because I didn't perform well on this test, it could be being able to look at, oh, how did others perform? That was a really hard test. So maybe I'm not stupid, right? Yeah. Like when I compare myself, like I'm falling in the realm of normal.
Yeah. Even using the language, like I notice I'm having that thought again, that pesky thought that's not true, that I'm stupid. Just talking to yourself in that way.
Yeah. Yeah, I like what you said at the beginning, and I use that with some clients of like I'm having the thought that. So for example, like I'm having the thought that I'm stupid. Like and even within that, you're diffusing from the thought versus I am stupid.
Yeah.
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 There's room to not buy into it, to not believe it, to not take it as fact.
Julian, will you give your example of driving in the car the other day?
Yeah, no, absolutely. Yeah, I was going to say we use a lot, Whitney and I, specifically with those that have eating disorders, because there's complex sort of thoughts and urges that can seem very real. And this is like a technique that we use with our clients. And I've also tried it on myself. And it works, people. So lately I have been having some, I would say, like diagnosable PTSD symptoms in terms of being hypervigilant and being very anxious and amped up while driving, because I've had a series of like car incidences, one major car accident. And for me, there is the emotional element, the psychological element of I don't like to be out of control or being perceived as less than competent in a car accident, like where that just feels like
it's super out of your control too, because you only have control of yourself and your car, and sometimes you don't have your control of your car if a tire pops or something.
Yeah, and so there's that emotional aspect that I'm aware of. But anyways, back to the story of me driving and being amped up the other day. I was just, super sensitive to any sort of bump in the car, just wondering, okay, what's going to happen next? And like I was able to stop myself, and I just said on repeat, my mind is playing tricks on me. My mind is playing tricks on me. My mind is playing tricks on me. Because I have tested my tires recently. And it is functioning. And so I was just able to externalize any sort of anxious, sort of my automatic trigger that has been happening in the car. And I was able to get through.
Well, and I think too, so with worry exposure, so if anyone's heard like exposure therapy, that's kind of what you're doing is, like Julian, you continue to keep driving, like even though it's
I don't want
really
to.
hard. Yeah, it's really hard for you, and you choose to drive sometimes, even when somebody else could drive, so that you can expose yourself to that. And same in social situations. If you get super anxious, if you continue to avoid it, it makes it a lot louder and a lot harder later on. So that's super important with anxiety, is like knowing that you can manage it, and like whether it's talking to a therapist or whatever it is, like having skills to continue to manage it.
Yeah. Yeah.
I love that you use the term like externalize the anxiety as something that is like not yours. Like you're experiencing it, but I think anxiety and depression can feel just so personal and so true and such like an attack on us. And then we, blame ourselves and beat ourselves up for it, but just externalizing it as like something that is universal and that everyone experiences sometimes.
Yeah, it's so helpful to talk about it and laugh about it.
Yeah,
for sure. So sometimes there's sometimes where that's not.
But I don't know. I think a sense of humor about it is definitely important.
Yeah, that's a coping skill, right?
Yeah.
like my fear of peeing my pants. A constant thing. I had a traumatic experience as a child. I peed my pants at recess. I was way too old to pee my pants. It was 6th grade.
And now you cope. You just go to the bathroom before every event.
Everything. And then afterwards, all the time, I have all my friends afraid that they're going to pee their pants now so we can laugh about it together.
I think now I'm concerned. I'm like, do I need to go to the bathroom? I did drink a lot of coffee, but I think I'll be okay.
Yeah. Let's take a pee break and we'll be back.
We'll be back after this break. No. But I use a lot of these things for that, and I've been able to manage it. It has not gone away, and sometimes it's worse than other times, but it is like manageable for me.
Sure.
Now,
you bring up a good point. What I've noticed and shared with my clients that struggle with anxiety is being able to look at lifestyle factors, and when there are periods of stress, that their anxiety is going to feel harder to manage. Do you ever look at that with your clients?
Yeah. If you're already, and it goes back to that bell curve, if you're already under so much stress and then something else happens, then absolutely, it's just layered on top. Hard to manage. So, for sure.
I like the term vulnerability factors.
Yes.
So being just mindful of like what you're going through day to day, week to week, month to month, phase of life. If you're going through like a divorce, that's a huge vulnerability factor. So knowing that, and so like lots of little things may seem way more stressful or cause a lot more anxiety.
Definitely. Or a death in the family.
Yeah.
Loss of a job. All those
just had a bad day.
Yeah.
Right.
For sure.
Yeah, it seems like, okay, awareness of context, awareness of like your family upbringing, genetic predisposition, and lifestyle is important.
Yeah.
And then the action piece, right? And not avoiding things that make you anxious, and instead learning how to cope with it and welcome some sort of, and know like some sort of anxiety is normal.
Yeah. And I want to get to lifestyle factors also, but just talking about, effective treatments for anxiety, wrapping that up. No, it's fine. We get sidetracked and I love it. But other things would be like distraction. So I think sometimes people think that distraction is bad, like, oh, I'm not dealing or coping with this. But sometimes it's really good to allow yourself a little bit of space from that overwhelming emotion and trying to use healthy distractions and then revisiting it at a later point. But that is a coping skill.
Can I ask a follow-up question that a lot of my clients ask me?
Yeah, sure.
I
don't know if I can answer it, but
you can try. I trust you. So a lot of my clients have some black and white thinking. And so for them, they're like, well, how do I know if I'm distracting too much or in avoiding?
That's a good question. I feel like that, like, ultimately we won't know. I think that it is a little bit intuitive and trying to find like a balance, but it might take a little bit of time, But I think ultimately, like, whenever I think about the brain and how it works, like our amygdala, like when it's fired up and like we flip our lid, so we're not using our prefrontal cortex anymore, our executive functioning, our planning, problem solving, all that stuff. So that takes, 10 minutes to an hour to get that back after an overwhelming emotion. So, I mean, I don't know if you could use like timing, like an hour of distraction or something like that, as a helpful, point.
Sure. Yeah. And then I think to look at, sorry, Whitney, go ahead.
Just like, I think you're not avoiding it as long as you come back around to it.
Okay.
Yeah. That's a good point too.
And then common areas to look out for if you're avoiding is like are you numbing? So anxiety, are you managing it like with eating, substance, like sex, internet?
Yeah.
Right.
Definitely.
And so like kind of gauging like, how am I living my life?
Yeah. And it is complicated because those can be distractions, right? And like using some of those things sometimes I think is okay.
Yeah.
As long as you're not like abusing it or overusing it as well. So it depends. It depends. Yeah.
As always.
The ultimate therapy answer.
Well, and then just to like throw out there that like avoiding and like shutting down that our one of our terms we've been really enjoying lately, like anxiety-based depression.
Mm-hmm.
So knowing that, like, if you are in like a spiral of just like avoiding, isolating, shutting down, that can then be like that anxiety that ends up leading into depression.
For sure. And
And
that's
seeing a lot of
definitely a
that flip-flop.
cycle that
Mm-hmm.
I think that we all see a lot in our clients. And going back to the nervous system, you know, like we're amped up for so long and our nervous system can only be in that amplified state for so long that then we crash. And then it's our parasympathetic system that's turned on and we're depressed. And then it just goes back around again. It's just stopping it somewhere. Yeah, yeah. So another effective treatment that I think a lot of people are scared of, and I want to address this maybe in a later podcast, is medication. But I see so many times somebody struggling so much and they're so terrified of trying medication because of the side effects and like horror stories that they've heard. And I get that. And that's definitely not my first point of like, let's try medication first. Like, let's get you some tools. Let's try some things. But I see people just trying to white knuckle it, you know, like it's so hard that they're just gripping intense and just really struggling to whenever I feel like medication can get you to a normal feeling to remember what it's like to be without anxiety or for the first time not to have anxiety.
Yes.
And to be able to actually like use coping skills.
Yes. Yeah. You know, I work with my clients on this too, and there's definitely like stigma, like I'm weak if I need medication. But when we go back to the biological underpinnings of anxiety, I mean, you can't really do a whole lot to bring up your base levels of serotonin.
Yeah.
I mean, you can do some things, right? Like sleep, meditation, and that can help to an extent.
Right.
But when there is like a deficit, I mean, why are we fighting?
Yes. Yeah.
And it can be, you know, as far as research in terms of long-term success, when you pair medication
With therapy. It's so effective. Yeah.
And it can be temporary too.
For sure.
Right.
Yeah, I think that the talking to a psychiatrist recently, they recommend that you be on medication for at least a year. And I have the psychiatrist that I typically work with, she'll use a lot of natural supplements to try and get you there before she uses medication, but she's not afraid to use medication as well.
Yeah.
But it does seem like for her, it is like a very temporary thing. And not for everyone. You know, some people do need to be on it long term.
Sure. Yeah.
That's okay too.
It depends, people.
It depends.
But if we look at patterns, like I think that's what I, you know, use when I talk about this with clients. If you've historically been like more, you know, just an anxious, wound up, worried person from childhood, like that kind of illustrates, you know, once again, the chemical imbalance.
Right. And being so
I've heard stories of people being like 3 and 4 remembering like fear that their house is going to burn down.
That was me. I think I told you that story. That was for sure me.
I mean, I know I've heard multiple, just like 3 and 4 years old when you know that you're anxious already. Like,
yes. Yeah. My mom told me at a very young age that she remembers me coming home and just being like so worried that it like didn't match what I was worried about, like friends not liking me or my house burning down or things like that. It just did not fit. So definitely, if you can look back at your childhood and kind of see that, then that's definitely an indicator to get some support, whether it be therapy or medication or both or whatever. The last effective, like researched, which doesn't mean that other things don't help, is mindfulness. We haven't had a podcast on that.
But we will.
And yeah, super excited about that. But that's a big one. And that's, you know, goes back to that relaxation practice as well. So, and being able to kind of like concentrate the mind and change your thought patterns and relax the body, the nervous system. So many things, you know, go into a mindfulness practice.
Sure. Yeah, using that observer role that Whitney described earlier. And then too, in terms of like working with the neuroplasticity of the brain helps. So then if you're the type that automatically goes to worst case scenario, like with time, it can help you have a more balanced approach, right? By creating literally new neural pathways.
Yeah. Having the awareness that you're doing that like quicker and quicker and quicker. And a piece of mindfulness that I think we talk a lot about on the show is non-judgmental awareness and kind of a compassion piece to that. So kind of taking away the shame and criticism to having anxiety or the thoughts that you're having.
Yeah, I think there's this cute little Happy Fi YouTube that is how mindfulness empowers us. And it just talks about, like, it's so helpful to know what we're thinking as we're thinking it and know what we're feeling as we're feeling it. And it's like, sounds so simple, but it's so true. I think, like, if we're able to pay attention to that and like know ourselves in that way, and then have some of these tools to label, like, oh, I'm, doing black and white thinking, or I'm catastrophizing, or I'm so tense and I'm having that short, shallow breath. If we can catch all that, then we can like implement skills to bring it down.
Yeah, definitely knowing when to use those skills.
Sure. Yeah. And Whitney, you just named several techniques of cognitive behavioral therapy. And is that on your list of researched and valid? Yeah.
Well, I said cognitive therapy,
okay.
but cognitive behavioral therapy. Yeah.
Yeah.
That's a big one.
Yes. Know the patterns of thinking and be able to challenge them.
Yeah. I think I'm like cyclical, like anxiety creates like these kind of unhelpful thinking patterns, and then the unhelpful thinking patterns create more anxiety, and then it's just a positive feedback loop
For sure.
of the like catastrophizing or shoulds or mind reading, feeling anxious, doing it all over again.
It's all connected.
Yeah. And I think that
mind and body connection.
that speaks to like our ability to, and I said this earlier, but perpetuate it and like make it worse in that way. And we aren't even aware that we're doing it. So that mindfulness piece of like, stop pausing and seeing whenever we're having those negative thoughts on top of negative thoughts, and kind of thought stopping or diffusing from it.
Yeah.
Oh, that's so true too. I've known a lot of people and experienced it myself where you don't know that you're anxious, or you don't really know that it's so normal and you're so used to it that you don't always know that it's happening.
For sure.
Like you're just used to running on anxiety level 8. So sometimes it can be helpful if you're just feeling like, that's why I like those physical symptoms like trouble sleeping, upset stomach, like headaches. Maybe it's anxiety. Maybe you can have someone help you figure out if it's anxiety.
Yeah, definitely. Yeah, especially those people too who like have grown up with anxiety. Like then if you've been in that since you were a child, like you really don't know.
That's
if you're
just
feeling
normal.
it. Yeah, it's like whenever I was a little kid, I remember getting my head was hurting. My mom was like, "You have a headache," and I was like, "I've heard that before, but that's not what this." Like it just doesn't click for you because you don't know. You're not putting 2 and 2 together. Or like the first time you have heartburn, it's like my heart's burning, but this isn't heartburn.
I had that experience. I was like describing it to someone, and they're like, "It's heartburn." I was like, "I don't have heartburn," and I'm like, "It just feels like burning, like in this area." They're like, "Yeah, that's heartburn," and I was like, "I don't think so."
No, that's not me.
So even the therapists like encounter denial.
Yes.
But we hope that you're listening, that us talking about this is, bringing to fact that anxiety is a real thing.
Yeah, for sure.
And there are real ways you can deal with it.
Yeah. And maybe we can talk, we don't have much time left, but just some tips that have worked for us personally and for our clients. I don't know. What do you guys think about that?
Oh, I have the ones that you made on that card.
Oh, yeah.
Should I read those?
Yeah.
So it's breathing, taking 5 deep breaths. So I like that you used 5 too, because I think 1 and 2 is good, but 5 is like really good.
Yeah.
I like, if anyone who can't see, like using your hand, you can trace one of your hands with your other pointer finger and inhale on the way up a finger, exhale on the way down a finger until you trace all fingers.
Oh, I like that.
It's a good one to get 5 in.
And just pause.
Yeah.
One of the ones that I noticed for my clients and for myself, and Whitney, you even mentioned it recently, was caffeine intake.
Mm-hmm.
And like your nutrition, like sweets and all that kind of stuff. Because I see so often that those people that are anxious, that they tend to kind of perpetuate it by drinking a lot of coffee or caffeine. And so
Or
yeah.
eat alcohol too.
Yeah, alcohol, tea, Coke,
Mm-hmm.
all those things. And Dr. Bourne, the author of the Anxiety and Phobia Workbook, he recommends if you do experience anxiety to have less than 100 milligrams of caffeine a day. And coffee has, 1 cup of coffee has 110 to 146 milligrams a day.
Right.
A cup of tea has 46, like black tea. A Coke has 65. So that tells you, like I was drinking 2 cups a day, and feeling super anxious, like going through the phase of feeling a little more anxious and like cutting it out, seeing my clients cut it out. It's so amazing, like the shift that it makes, but it's hard to do.
Yeah.
Mm-hmm.
Like getting anxious as you're talking about this.
Yeah.
Thinking about when at that time where I was drinking like 8 cups of coffee a day. Yeah, not good people.
Don't do that.
But I was doing it because I was working insane amount of hours and I was depleted.
Trying to keep up.
I was trying to keep up.
Mm-hmm.
And this is where I think it goes back to lifestyle factors. So, I was anxious, like I can't get through the day without this. And I had to make a conscious effort to eventually change the way that I was working. And now I'm drinking, and I'm so proud to say typically 1 to 2.
Except for today.
Except for today. Today I'm like 4 cups of coffee and an energy drink right here. Yeah. However,
Occasionally,
okay. On most days I'm down to 1 to 2 cups. And I do think it's really helped. And I don't realize, I guess maybe, how I can be more amped up than I realize.
Yeah.
Yeah.
Well, and it speaks to the nervous system again, right? So you are basically with caffeine, you're turning on the sympathetic nervous system, the fight, flight, or freeze.
Yeah.
And so you're already tapped into that. So if you can decrease that, you're a little more leveled out and able to use it, like have more control of it.
Yeah.
Mm-hmm. I've even found just like knowing that, like, take a break from coffee, but I'll, drink it again because I love it. But just knowing, like, oh, I'm feeling anxious today. Did I have more coffee than usual? And then just knowing that can help me, like, not buy into, like, some of the crazy thoughts that might come in.
Oh, I love that.
That's smart.
Like, no, I'm just a little more amped up because I had coffee. It doesn't mean that I've done something horrible lately.
Right.
Well, before we wrap up, I guess maybe we can list some of our favorite tips on the show notes.
Yeah.
Yeah.
Okay. No.
Can I give one more?
Yeah.
Okay. So one of mine is journaling, which we hear that a lot, right? To journal. And I feel like a lot of people, a lot of clients are like, but I don't know how to journal. I don't know what to journal about, all that stuff. Like, it doesn't have to be pretty. It doesn't have to be right. Nobody's going to read it. Like, just dump your thoughts. And I'll have people set aside worry time. Mm-hmm. So maybe it's like an hour before they go to bed, because that can be when the thoughts really amp up, or whenever they wake up. And so throughout your day, you're kind of thought stopping and saying, no, I'm not going to go down that path right now. I'm going to leave that for worry time at night. And typically what happens, people can't even spend the whole hour that they've set aside to do it, because like it might not be that important at that time. So in the moment, it might feel a little more urgent, right?
Yeah.
That's what anxiety is. It's like there's this urgency.
Yeah.
So that's my last one.
Yeah. No, that's
One
Yeah,
more.
we can.
Fine.
Okay.
We'll find someone to talk to.
Yeah.
Reach out.
Yeah. I mean, I think all
Friends.
of this is helping thoughts give less power.
Yes.
Yes.
Less power. So,
Yeah.
And so, speaking of talking to us, you can find us at
whiterockcounseling.com. And where can you find us at, Julie?
Everyday Therapy Podcast.
The podcast that we're on.
Yeah, you can find us on Instagram, Facebook, and YouTube, and iTunes. Please rate and review us. We have a donation set up on our website, everydaytherapy.com. Resources for our podcast today. I love the Anxiety Phobia Workbook by Dr. Edmund Bourne. And I will list that in the show notes. But thank you guys so much for listening.
Yeah, have a wonderful weekend.
Adios.
Can y'all still hear me? Oh, I can.